Dentist Federation. Ladies and gentlemen, I'm very proud to introduce Dr. Gerhard Seeberger. Round warm of applause.
Well, first of all, it's not 3D printed, so it's allowed to be not correct. Good. First of all, good morning, everybody. And my very special thanks to the organizers who invited me to speak to you today about partnering for an economic, political, and social opportunity. I see that the slides might be a little bit mixed, but that's not that important. So, first of all, Stephen, thank you for introducing me, but let me tell you my little story. I started in dentistry in 1985 as an employed in private dental practice. Then in 1988, I became the owner of a private dental practice. I am a collaborator of dental industry firms. I'm the past president of the Italian Dental Association. Then I became the president, as Stephen said 1 month ago, elect of the World Dental Federation, and I'm also contemporarily the president-elect of Academy of Dentistry International. And this is what I represent today, as I would like to transfer to you that probably medical doctors are a little bit different from the fellows from the industry, because they have written social responsibility on their chest. And last but not least, I'm still an excited wet finger dentist, acting locally and thinking globally. So when I stand up in the morning, I just know what I need to do. That's a wide range. And I'm really very happy to present to you the new definition of oral health, which came out in September 2016. And just let me read it off. Oral health is multifaceted. It's just not having teeth and be able to chew. It includes the ability to speak, smell, smile, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. So if we look to that, and we know that dentists are trained in one part of the university while medical doctors are trained in another. It's separated. One is called medicine, the other one is called dentistry. And let me give you a citation of Titus Schleier, who is an informatics specialist who wanted to unify the dental database and the medical database in the United States. And he just finished up with the sentence, "The separation of dentistry from medicine is a historical accident." So, furthermore, just 1 month ago in Madrid, when we had our World Dental Congress of the World Dental Federation, we came out with 2 new policy statements, one on CAD/CAM dentistry and one on sustainability in dentistry. And here we link to 3D. We link to additive manufacturing and what that could mean in making dentistry sustainable. The other mantra of the Academy of Dentistry International is sharing knowledge. We know the production chain in dentistry in order to reproduce lost parts of the human mouth, of teeth. But it's the knowledge that will be the key to how successful additive manufacturing will be. Sharing knowledge of oral health to improve the quality of life throughout the world. And there, as many voluntary projects are run under the aegis of the ADI, social responsibility of the medical profession. For whom do we need this? I was sitting in front of my computer when the worldometer, you've written it here, when the worldometer was counting at 8 o'clock, 54 minutes, Central European summertime, we were shifting from 7.49999 and so forth to over 7.5 billion people in this world. So if we want to follow the vision of the World Dental Federation, leading the world to optimal oral health, we have just something to do. And my question here, right at this point, is do we want to be exclusive or do we need to be inclusive? And when the goal of the industry is to make profit, the goal of a responsible medical profession is for sure, from an ethical standpoint and also from a legislative standpoint in the administrations where we are active to be socially responsible. Where can we meet? On the other hand, and especially here in Europe, we know that in our continent and worldwide, but in our continent especially, 65.6 million forcibly dised people. That's what we count. And they have probably more oral health needs than the residents in their countries. That's more or less the population of Great Britain. So the prevalence of diseases in the world, and you have here a number, 3.5 billion are affected, and that costs us $442 billion yearly. But what is the most prevalent disease on this globe? You would not have said it. It's dental caries. And what is number 6? It's periodontal disease, and this is the only tissue, the periodontium is the only tissue where you have associated 3 different types of tissues. So let's go further. What about our children? Caries in our children, number 10. And number 28, that's from the last Global Burden of Disease Study 2015, it's 28, number 28 is people without teeth. Only in the country of Brazil, you have more than 30 million people without teeth. What a business for additive manufacturing and for industry. But also, what a good answer to give function back to these people from a social responsible standpoint. So just in 5 years, from 2010 to 2015, from number 36, we have come to number 28 and counting more and more edentulous people. I will just give an answer to some of these bullet points. So if we want to use less resources, natural resources and human resources, if you want to be most effective with a labor hour in 1 hour, if we want to reduce production time, then probably the best answer from a social responsible standpoint would be prevention, avoid disease. Of course, there's not a lot of 3D business in there. Maybe we can talk about this in the very near future and maybe also after my presentation. Of course, we want dental manufacturers to be encouraged to develop more sustainable dental materials and technologies and use materials that are biodegradable and or recyclable whenever possible. The resins for 3D additive manufacturing shall be without bisphenols A and S and any other endocrine disruptors. Why that? Just not even 1 year ago, 2 German specialists showed up in front of the US Congress and were explaining what these endocrine disruptors do to us. And it's not only what we observe in studies with rats that sexuality may be downsized, but if your children are born and the formation of dental enamel, which is the protective part of your teeth, is interrupted, and you have frontal incisors, so it affects also your social life, then what? Then probably we are called to be active immediately. And of course, we shall think of low power and low pollution technologies that should be promoted. We need collaboration. We need collaboration among all parts, between manufacturers, academies, researchers. We shall go for translational research, and this does not only involve the dentists, it involves also medical doctors, and it involves also our dental lab technicians who are so afraid that something will be taken away if 3D additive manufacturing goes forward. And that's not true. They just need to be active, what is in first row to do now, and that's knowledge transfer. And we need all other stakeholders in continuous education to improve the final product. Where? Everywhere. For 7.5 billion people, I cannot repeat this enough. We need to reduce the costs and to better inform and educate dentists, only dentists, or shall they be also a part of patient literacy? on innovative therapeutic solutions, their indications and contraindications. So are we still riding that old traditional horse, or do we need to speed up? There was some information coming from Italy just a couple of days ago. Our patients are already in 4.0 dentistry, but is the dentist as well? Probably not. And let me talk about and look at something which is amazing. The only energy here needed is gravity. And this filtering device, not more than 20 kilograms of weight, you can transport it in every part of the world. Just think of the conflict now in Yemen. And more than 300,000 people already died of cholera. You could downsize this with this device to 0. And what do I want to say with that? Transport is one of the main cost factors when we want to deliver 3D products. So why not thinking of a larger business? 7.5 billion people out there are your potential customers. So probably we should be active on a large scale in the diffusion of 3D knowledge and 3D additive manufacturing. Furthermore, we need open systems and better to communicate better. The initial formation and continuous professional development in 3D additive manufacturing for dentists and laboratory technicians in this continent and worldwide shall be implemented. User networks at a local level to mutualize the weight of equipment investments need to be developed. 3D additive manufacturing devices still cost a lot, and they cost an awful lot for some realities. And we need to be inclusive in 3D additive manufacturing dentistry in order to guarantee a win-win situation for a socially responsible oral health professional team, a commercially successful provider, and a health-seeking global citizen. This is my dream. This guy is just fantastic. And it's not just fantastic because he goes to a sustainable source of energy, which is sunlight, and he goes to a sustainable source of resources, which is sand, in order to make out something that might be very similar to glass. Could this glass have different colors? The colors of a tooth, for example? And we know that with the plastics, we are not there. I don't want to go in detail now with the function in the oral cavity. What part is of the teeth? What part is of the muscles? What is the part of our bony tissues? But this is just a dream. So we could go everywhere. We could realize also high-tech, probably, if we go further with this concept everywhere. And let me finish with one concept. I said, in the periodontium, not to make myself important as a dentist. I could be important also just as a Bavarian boy. But we have 3 tissues that we could regenerate. Not only put an implant into the bone, which is nothing more than a modern concept of having a wooden leg. But we could regenerate, probably with nanojets produced scaffolds, the promotion, the biology, the biological input for cells in order to regenerate tissues and have a functioning tooth again in your mouth. But this is just a dream. Let's work on this together, and don't forget to always believe in yourself. Thank you very much for your kind attention. I hope I was best.
You were not. You were very entertaining. Very pleasure to have you here, and an honor